Hello and welcome back to the Intersect. I'm so excited today to be joined by another Emily. I've got to ask, what year were you born? I'm just curious.
1989.
Okay, me too. And I feel like that year and the following year, I think Emily was the most popular name.
It was. You're absolutely right. And it was for like 8 years running or something like that, I'm
It
pretty
was
sure.
kind of crazy.
It
I
was a
don't know
lot
if
of
you
fun.
had this experience, but when I went to high school, I think there was 5 or 6 other Emilys in my class. And my classmates got so frustrated. They were like, okay, you're all just going by your last name.
So funny. Yeah, no, we didn't have I was the only Emily in my class, but I was also a pretty small school. So we had like 150 kids in my class.
Okay.
But it wasn't until I got to college where I started encountering a lot more Emilys.
Yeah.
But it's funny because I never had that experience. It was probably like I don't know, Michelle or something like that had a lot of them.
Yeah. It went through phases. And now my poor daughter, her name is Evelyn. And the year that she was, yeah, now
I know a
everybody
lot of
names
Evelyns.
their daughter Evelyn. I know. So yeah, I guess it goes, but we were, she was born in March, so we were ahead of the cusp. Anyway, but I'm so excited to have you here today. You are the owner, correct, of Fiat Physical Therapy in Alexandria, Virginia. And it's pelvic floor physical therapy. That's what we're talking about today. We're talking specifically about how it relates to prenatal and postpartum care. And this is definitely an area that's I'm a little bit selfish with wanting to cover this topic because I know our intro says that I'm like in a stage of secondary infertility, which I was. I'm now 37 weeks pregnant. So this is very germane for me right now. But anyway, Emily, I'm so glad you're here. If you could just tell us a little bit more about yourself and then we will dive on in.
Absolutely. Yeah, and I hope that you get to ask some questions about yourself, honestly, because I love to answer any questions that people come up with. Yes, I'm a pelvic floor physical therapist, but that started a little bit later. I actually never wanted anything to do with pelvic floor physical therapy. So I remember being in grad school and just saying, yeah, like I'm not interested in vaginas, so I'm just not going to go there. I was like, we're going to skip over all of this. I'll memorize what I need to know for tests and whatnot. But I had a clinical instructor who was an orthopedic and pelvic floor therapist. And I only sat with her. I only worked with her on her orthopedic patients. So I was never in like behind closed doors with her pelvic floor patients. But I remember them coming out and saying like, this stuff changed my life. And I was like, oh, that's good. I'm glad that somebody else is doing that. Like, we need that in this world. But it's something that has always been kind of knocking on my door, and I've just kind of kept that door shut in a lot of ways. And so after I graduated grad school, I went to do a residency a few years later, in an orthopedic residency up in Baltimore. And the pelvic floor is always something that's regarded as, oh, like we'll let those people deal with it, the people who actually like work with the pelvic floor. And like that's never really sat well with me, because I'm like, if you're having issues peeing or pooping or with intimacy, or you have like back pain or hamstring pain that like doesn't seem to resolve, like, oh, just send them to the pelvic floor therapists. And I was like, well, why can't I deal with that? I'm an orthopedic therapist. Like, so that always bothered me. But when I was doing my residency, I worked with pelvic floor residents as well. And I became friendly with the residency director, and she really encouraged me to take these extra courses. And I very reluctantly did, because our clinic was hosting them. And gosh, it's been so different than anything that I thought. Like, yeah, it's a nice merge of all of the things that I'm interested in. It's very orthopedic in nature. You get to work with like a lot of different women, like talking about very vulnerable things. And like, I really like that space. So it's been fun. And so after a little while, I started to work for myself and get to see how many people I want in a day. And it's kind of nice to do things on my own a little bit. So
Yeah,
yeah,
that's
that's how I
awesome.
ended up here.
That's awesome. And I'm just chuckling because, you're saying this was the last thing that you wanted to do. There have been so many things that I've said is like, I would never do that I started doing. And then I was like, oh my gosh, this is actually amazing. Like, I love this. So I'm just chuckling at that aspect of your story. It's like, never say never, never say never.
I was like very resolute about it too.
Yeah, I've been resolute about things too, and it usually comes back as actually this is great for you.
Oh, perfect. Yeah.
The synthesis of like all these things that you love. And audience, I did forget one little housekeeping thing. In about 10 minutes, I'm gonna have an alarm go off because I have to test my blood sugar because I do have gestational diabetes. Which we will continue to talk right through, no worries. But if you hear a phone go off and weird clicking sounds, that's what that is. But anyway, okay, back to chatting. Okay, so we've talked about the pelvic floor here on the podcast before. But before we dive deeper into, prenatal and postpartum specifically, can you just give us a quick overview of the pelvic floor, how it functions, kind of, it's the name kind of covers where it is, but it affects a lot of different areas. If you can just give us an elevator pitch about the pelvic floor, I guess.
Oh my gosh, Emily, I have a hard time doing elevator pitches about anatomy.
It's hard. I know.
I love anatomy. Because it tells you a lot about function. But I know that your last guest, it was a great episode, by the way. And if you guys haven't listened to it, please listen to it. It's fantastic. They brought their pelvis, so I brought mine. And so the pelvic floor sits at the bottom of the pelvis. So what is your pelvis? Because let's be real, I didn't know what any of this stuff, I knew what a pelvis was when I was in grad school, but before going into the pelvic floor PT, I didn't know much about the pelvic floor. So this is your pelvis. It sits, like, think about these are your hip bones. And it's 3 different bones that are all come together. And you want to think of it like a bowl, right? So the bottom of your bowl is your pelvic floor. Your pelvic floor is very different than pretty much any other muscle in your body. So other muscles in your body cross a joint. And what that does is it ends up bending the joint. So if you think about your biceps, it crosses your elbow and it bends your elbow. The pelvic floor doesn't really do that because it attaches onto what you might have heard it to as your sits bones before, and they're not going to approximate these bones. These bones don't move together. They don't really come apart. And so what it does is it creates tension. The other thing that's interesting about the pelvic floor is that it actually has 3 holes in it. There's no other muscle that really has holes in the muscle. And so that kind of informs what it does functionally. It helps with closing and opening those holes a little bit. So the pelvic floor, it has 2 layers. It has a deep layer and a superficial layer. And as I said, it encompasses these holes. So it has those holes for your urethra, your vagina, and then your rectum. And basically you want to think of it, since it's at the bottom of the bowl, within the bowl is also all of your organs. So your bladder, your uterus, and your colon/rectum. And it responds to pressure. So if you were to put more pressure into, like, going down towards the bottom of the pelvic floor, it has to respond and contract appropriately. So you want to think of it kind of like a trampoline. If you're jumping on a trampoline, you put more pressure down, and then the trampoline has to have enough tension in it to push back up with an equal and sort of opposite force for a trampoline. But that's really what the pelvic floor wants to do. So why is that important? So we think about, let's just talk about like going to the bathroom, like going pee, because this is something that's really important, or it becomes more effective with people who are pregnant or postpartum and whatnot. So as your bladder fills up, it's going to create more pressure going down into the pelvic floor. And if we think about how liquids move, they move from areas of high pressure to areas of low pressure. And so in order for the urine to stay in your bladder, the pressure from your urethra has to be greater than the pressure in your pelvis. So it has to be forced shut, right? And then to go to the bathroom, it has to relax. So from a sphincter level, like, there are muscles that also like govern like the closing of the sphincter, but the pelvic floor is also involved with that. And so it has to be able to relax to allow for like a decrease in pressure from your urethra. That's how that kind of happens. Now, where this is important with people who are pregnant, women who are pregnant, is that you're getting more pressure going down because you have a baby and you're gaining weight because you have to support the baby. And so the pressure from from your bladder filling is actually a lot more than what it might normally be. And so you'll find a lot of women say, well, yeah, like I kind of pee my pants a little bit when during certain parts of my pregnancy or postpartum. That's pretty common. So that's kind of like what the pelvic floor does, and it responds to pressure. And the thing is that you generate pressure whenever you do anything. The pelvis is pretty unique because it sits at a crossroads of like your upper body and your lower body. So it gets forces from both directions. And it kind of has to, generate tension. And it's always, the thing is that there's always some kind of baseline tension, which is the other reason why it's a little bit different. Whereas like if I'm at rest and my arms are down, there's no tension in my biceps until I contract it. There's always some kind of baseline, like static tension in the pelvic floor.
That's fascinating. No, I've never heard that explanation. And I really appreciate how you really tailored it to like, women who are pregnant and, because a lot of women I know, they think, well, I didn't have, I've had 2 C-sections. People are like, well, I didn't have a vaginal birth, so therefore my pelvic floor is fine. It's like, no, you held a baby, and like you said, and all this additional weight. And one of the things that I learned that I thought was really interesting about the pelvic floor is like, you're talking about these other muscles, like your biceps or your back muscles or your neck muscles or whatever. These are all vertical muscles, whereas the pelvic floor is lateral. And I think the only other muscle that's like that in your body that's like kind of predominant is the diaphragm, right? With breathing. So yeah, it's a unique system of muscles that kind of take a whole other way of thinking and exercising them.
And one thing to add to that too is like, so it's true that like women who are pregnant might feel like they like can't hold their bladder as much, or like, but like this also can happen when you're not pregnant. So like if you're going into pregnancy with like a history of this, like let's say you go for a run and like at the very end of the run, like you're tired and like you kind of pee a little bit and it's like fine, or like you sneeze and pee, like this happens outside of pregnancy as well. And that's something that like I don't know that there's a lot of emphasis on that. Like you might hear of like, heavy power lifters do it like when they're doing like a snatch or something. But yeah, like these things, I want to say like these things don't just like get better on their own,
Right.
And like you would like to think that like when you're pregnant and you're going through pregnancy, like it's just adapting to the load over time. Like, but that's not always what happens. That's not really how it works,
Yeah. Yeah. And I know, I've heard so many women, even my mom one time, she was like, oh, I'm too old to be doing pelvic floor physical therapy. And I was like, no, I was like, this is actually part of that help. The more I learn about pelvic floor PT, I'm like, this should just be basic healthcare, like basic maintenance. Like now that I'm pregnant with my third, I've learned so much about how I could have benefited from this kind of PT during and after all of my pregnancies. And it's just so frustrating that this is not like the common thing in medical practice to recommend this to pregnant patients. I actually, in my current pregnancy, like after finding out about all this stuff, like early on, I think I was 7 weeks pregnant and I was in an early appointment and I was like, okay, I need a pelvic floor referral and I need a chiropractor referral. And she looked at me, she was like, what's wrong? What's wrong? And I was like, nothing. I just know that like this is something that I want to maintain. I want to be proactive about. And I really did kind of have to, I had to go back several times and be like, hey, I need these referrals. And I really did kind of pester them a little bit. But it was so, yeah.
Because here's the other thing. So like we're gaining a lot more knowledge of everything, right? From pelvic floor. And you can thank a lot of social media for that. And I think that's a great thing. And a lot more, doctors are becoming more open to something like this, but like for a long time, like nobody used this, like, or like it wasn't really used.
Right.
So
when you get old, you buy Depends, and that's just normal. That's what you do.
Yeah.
Yeah. And it's like,
never too late.
right. And that was something that was really surprising to me. And like, now that I'm learning what I'm learning, I'm starting to look at those things like Depends and be like, okay, no, actually you shouldn't be out there. It is. You shouldn't be wearing adult diapers. Like, no, there's a better way to do this. And oh my gosh, it frustrated me so much because, during one of my appointments, I was talking to my doctor about wanting to pursue a VBAC. And I kid you not, his reasoning for, one of the things that he told me to try to discourage me from having a VBAC was that he does a lot of urinary incontinence surgeries on women later down the road. And I was like, well, I'm going to go to a pelvic floor PT after a birth. And so he was like, oh, okay, then you're fine. And I was like, wait a minute. So you knew that this would have benefited me, but you want to scare me out of having a VBAC because of later urinary incontinence surgeries, but you know that there is like preventative, proactive things that I can do.
It's wild.
Make it.
It's just wild.
Yep. I was like, well, you get paid 2 times. You get paid for a C-section surgery, and then you get paid for a urinary incontinence surgery.
Yeah. And I should add that like urinary incontinence surgeries like should be like the very last resort. And like, that should just be a note, just in case anybody's kind of listening to this in that boat or knows somebody in that boat. Like, you can find a good PT to help you with that.
Yeah. Okay. So speaking of that, let's kind of dive in deep to prenatal care. Cause I know, a lot of people are like, all right, well, I'm pregnant. What really can I do to, prevent all of this stuff? Like everything that you're saying, our listeners are like, oh my gosh, yes, get me into this. So how does pelvic floor PT actually help during a pregnancy? When should women start pursuing it? And then do you have any recommendations? And we can kind of cover this at the end too, maybe as kind of a wrap up, but getting started with a specialist. I asked for a referral from my doctor, but if there's other ways going about it.
Yeah. So, so just to get that one out of the way, most states have direct access. And so you can go straight to a PT before going to the doctor. Now you might need to get a referral eventually. Certain states, you don't need a referral at all. In the state of Virginia, you need it, after I think about a month or 10, or it's a certain amount of visits. And I should know that off the top of my head, but so you can go and at least get an evaluation, and then hopefully your PT will be in contact with your doctor if you give the PT their information and whatnot. But yeah, so I would check. Most PT should know what their rules are. But from that perspective, so like, let's say that you're prenatal, right? So what, like, we have to kind of think about mom's health during pregnancy. And then also we have to like kind of think about labor and delivery as well. Mm-hmm. But like starting like during pregnancy, like your body changes so much. Like you are growing another child. It's all coming like to the front of your body. Like our body has natural changes to accommodate that. And one being like we lean back, like we have an increased what we call lumbar lordosis. And that's normal. That's not just a common thing. That's like a normal thing too. And so, but with that can come a lot of pain. You can get kind of like nervy pain. You can get just like localized low back pain, all of that stuff. And certainly like because of the changes and because you're all of a sudden like gaining weight in different locations, learning to move more efficiently is always helpful. And so you can kind of identify areas of strengths and weaknesses and figure out like how to avoid pain. That's one thing that you could do. Also, like, let's just like, so I think that the recommendations for women who are pregnant, I think it's 150 minutes of moderate exercise per week. And so that's like the same as a normal non-pregnant person.
Yeah.
So like you want to stay exercising. And so what that means, like, because what ends up happening is it helps to decrease your risk of a C-section or a baby who's over 8 pounds. It helps to decrease your risk of gestational diabetes, or high blood pressure. And so, and also it will decrease like the maternal weight. So like as we gain weight, like you won't gain as much. And so like there are a lot of benefits to exercising. And so you want to try to make sure that there aren't barriers to that. So that's one reason to go to pelvic PT, because, that's not necessarily pelvic floor related, but at the same time, I think that pelvic floor PT can be a misnomer sometimes. So that's one reason. But as we're thinking about like any kind of complications that can happen, so we talked about like urinary incontinence, peeing your pants a little bit. That's something that can still be helped actually while you are pregnant. It's not just like, oh, just wait till it's done. No, like get your pelvic floor in good shape. And so it's not just Kegels. Like I have to throw that one out there.
That's the thing that's usually pushed. It's like, oh, just do Kegels. And I'm like,
yeah,
how do I know I'm doing it right?
Okay, so hold on. Like let's go into that for a second, because so pelvic floor PT has gone through like this whole trajectory, and there was one point where like Kegels was the answer, and like that's what they really thought that like you should be doing, because you're like, okay, theoretically, like I'm contracting, and that would mean that I'm increasing the pressure that the sphincter, like in the sphincter, and so it's stopping that. And so there was like years, many years, where that's like all pelvic PT was. Now they've done more research, people have more clinical experience, and they're like, okay, but that's not exactly how the pelvic floor doesn't function like other muscles function, just kind of like what we just talked about. And so how can we get the pelvic floor to respond to load? And are there other muscles in the area that are causing you to put more load on the pelvic floor? So like if your hips are weak or not as strong as they could be, then like you're going to lose energy going through your hips, and like it has to go somewhere, right? It doesn't just get dispersed into the air. It goes down into the pelvic floor, and so you end up getting more force through there. And so that's where like cleaning up biomechanics can be really helpful, or like working on strengthening your pelvic floor in a very specific way that's very functional and a lot more fun, I think. So that's that's another reason to go during pregnancy. Another is like, okay, if you have a history of pelvic pain for any reason, or a history of something like constipation, and you are pregnant, right? If your body anticipates a vaginal delivery, I'm assuming that you would anticipate a vaginal delivery as well. Your pelvic floor has to be able to stretch 3 times its normal length during a vaginal delivery. Yeah. Like, isn't that wild? Like 3 times, like what other muscle has to do that? Like, no wonder there's so many tears.
For those who are listening, my eyes, I think I looked like Marty Feldman there for a second.
It's true.
I did not know that.
Yeah. So like 3 times. So if you have a history of pain or increased tension in your pelvic floor, yeah, like go get that checked out. Go get that looked at. I would think that you would want that checked out anyway.
Yeah.
But especially anticipation for birth, because who is it? So you have to also think, who are the people who are most likely to tear from a vaginal birth? It's first-time moms, and people who've had tears before. And so making sure that, your muscles aren't in this like overly tense state will allow them to relax, will allow them to stretch as much as they need to, because they really just need to get out of the way during birth. That's like,
I really want to kind of hone in on this, because I know some women think like, oh, I need to tighten everything up. And it's like, no, actually leading up to birth, you need to have everything be relaxed, not to the point like you're talking about where, your sphincters are not working and all of that type of stuff,
right.
But to have kind of this balance between this tension and relaxation, because the more tense you are, the greater your risk for tearing.
Absolutely. And so I don't normally like analogies to other punt muscles because it's different, but I'm going to use like your biceps as an example here. So normally you're like, a muscle has to be able to go through a full range of motion. It has to be able to contract all the way and has to be able to relax all the way. That's how you get like the best bang, like that's how muscle is best used. Now, like if you think about doing like a really hard workout and you are at the point where like, you're like, okay, my arms are super sore. I can barely straighten them, right? Think about like how it feels to try to straighten your arm all the way. Now, granted, this is a different muscle, like a different type of muscle, but like, I think that gives like a good idea, like to what we're talking about, like to stretch that muscle that's super, super tight is painful. And like you're getting a, 6, 7, 8, 9, maybe 10-pound baby out through your vagina. Like that's a big deal. And so that's when you're more likely to tear. So making sure that like you don't have like a ton of tension, but like the people who are more likely to have that tension are the people who have a history of pain, and they'll know that they have a history of pain for whatever reason that is.
Yeah. And I think just to kind of highlight too, what you were talking about, if you have a history of constipation, that's a history of putting a lot of pressure on your pelvic floor. And so that's kind of how that ties into what you're talking about, that, it is this like when you bear down consistently. I know there's going to be some Creighton practitioners who might want to come after me for that one, whatever. I've actually, like, the more I learn about the pelvic floor, I'm like, maybe we should change that protocol. Anyway,
all right. You have to be able to do it in some ways,
in some ways, yes. But if you have, like, if it's consistent, like you're like to the point, like, with constipation, that's like a different kind of bearing down. I think it's a little bit more intense. So that's kind of how that ties in. But yeah, so it's, and
one more note there too.
Yeah. Sorry.
Oh, I was going to say one more note there is like, if your muscles are really tense, like they're not going to be able to relax, so you're not going to be able to pass stool. And actually, while we're saying that, like some people who leak urine also have tight pelvic floors. And that's something that like a lot of people don't actually know. Because what ends up happening is that like you have so much tension through your pelvic floor, and like, so like, here's an example. Like, let's say that you have your arm out in front of you and you're holding an empty cup. Okay. You can do that for a while, right? Like you're tensing the muscles and whatnot, but like, let's start to add stuff to the cup. Then it's going to get more fatigued. It's going to get weaker. Yeah. And so the same thing happens. Like if your pelvic floor is in a tense state and you are doing something like running or jumping, like it just gets tired eventually because you're adding more and more force to it. So like in general, if you're having any kind of weird symptoms, like and you're pregnant, or like you have a history of weird symptoms and you're pregnant, then like I would definitely get it checked out.
Yeah. Yeah. Just kind of thinking through those red flags that I think we do kind of accept as normal, oh yeah, I pee a little bit when I sneeze. But so what? I'm pregnant. Like, who cares? Yeah. It might be worth checking out. Yeah. Okay. So let's move on to postpartum care, because this is where it gets, really
weird.
Thank you. I was gonna say juicy. Weird's a much better word.
You're not gonna get pregnant.
So I think, first of all, kind of as I mentioned at the beginning of the episode, this is relevant whether you've had a vaginal birth or a C-section. Yeah. I know a lot of women are like, and frankly, if you'll forgive I just need to get on my soapbox for a second about C-sections.
We can talk about C-sections.
It's just like, it's major surgery. And that's my soapbox, is that it is major surgery and it is not treated as major surgery. You literally have 8 or 9 layers and an entire organ sliced through. And then you're told to go home and just get some rest. And, just don't lift anything heavier than your baby and try not to go upstairs too much. Name me one other surgery where you're getting something that intense and the prescription is go home and stick your feet up and, just try not to do something crazy. Right. Yeah. I'm like, no, everybody, like anytime somebody gets a surgery like that, they get rehab. Like,
for sure.
You get rehab. So why this isn't happening with C-sections, I don't understand it. Anyway, I'm off my soapbox now. Felt good to get that out. So there's all kinds of recovery and healing techniques and exercises that women can incorporate and build on during their postpartum. So let's get into the weeds here. Whether vaginal or C-section birth, And, when should a woman start? How often should she expect to go? And then clue us in on those different massages and things about that can help C-section scars.
Yeah. So I'm probably gonna
I could really have done just an entire episode on this one question. Let's be honest.
We could. And here's the thing. So let's just walk through what ends up happening postpartum. So you have a baby, regardless of the method or the delivery method. You have about 6 weeks, you go to the OBGYN and they say, yep, you're cleared for everything. And then what I end up seeing is a lot of people just start, and they start hard and they do everything. And they end up having a lot of issues. So here's the thing. You're pregnant. Your body changes over 9 months. It takes 9 months to change. It takes time to change back. And so a lot of people like to bounce back. A lot of people think that they should be at this certain level when it's not necessarily true. Like, your body needs to recover because it's like a pretty big event, like whether or not it's a C-section, like just the labor itself is a pretty big event. And so I would like to say there is actually stuff that you can do before 6 weeks. And there's plenty that you can do. It's just not overdoing it. So the biggest thing that I see with moms is that your belly stretches for 9 months and then it comes back. And so during those 9 months, like, your organs get pushed up, your diaphragm can't move like up and down as much, like your ribs widen, like there are a lot of changes, and that doesn't just like go away like the second that you give birth. It has to contract, it has to relax. So the reason for the 6 weeks is because that's about how long it takes for the uterus to contract back to a more normal size. But during that time, I think the first thing that somebody should be doing is reconnecting to their breath. And it sounds like the most boring thing. It like really does. I know. But being able to fully expand your belly, like out or forward, and then also out to the sides, is so hard to do when you are postpartum. And that's even if you've like been working on that. And so doing things like that. And so here's the thing, like, the amount that you can do is going to be based on your fitness level going into birth. So if you are this power lifter who, normally deadlifts like close to 300 pounds or something, like, and like you like to work out like that, you might be able to get back a little bit faster. But if you are someone who you're like, I don't love exercising, I like to do it so I can stay active and stay fit, maybe give yourself like a little bit more rest. And so there are things that you can do. You can definitely do some body weight stuff, because guess what? You're picking up your kid, you're walking up and down stairs. So like, you can stand up from a chair, you can walk up and down the stairs. There are a lot of floor exercises that you can do, like a bridge. But here's the thing, like, you always want to be monitoring how you're doing and like what your body is perceiving as too much. And so like, one thing to mention, like, yes, like you bleed for a little while, like after giving birth, but like there's a time like that should subside, or that should kind of like lessen. Now, if there's ever an increase in bleeding, if there's ever like these feelings of heaviness, if you're starting to leak, like these are all signs to slow it down. But yeah, there's a lot you can do. And so it's hard to be prescriptive about it, because it really depends on a person's fitness level going into pregnancy, and then going into birth as well. But certainly, like, you can do things to like adapt back to your breath, back to your diaphragm, certainly mobility, because guess what? Like, you don't twist or turn when you are pregnant.
No, you don't.
No, it's like a whole body movement, and
You
it's like,
try, but it
yeah.
doesn't work.
And I've even had people ask me, they're like, oh, I thought you weren't supposed to twist. And because like, these are things that people are told, and no, you can, first of all, you can twist, like, please twist. But Yeah. So like, I would say like getting back to like letting your body, just recover, letting it relax, but also like moving it in like pretty intentional ways without overdoing it, paying attention to, um, you know, the signs and symptoms that like you're going too far or you're not. And guess what? Like if you have a little bit of extra bleeding, like, okay, it's a sign. It's not gonna like, you're not gonna die over it, but you
Right.
know, you can certainly like that, like you'll know to back off.
Yeah. I love that emphasis on gentleness, because I don't know what it is, if it's like, if American exercise culture is just like, no pain, no gain, it's like, please don't apply that here.
Mhm.
Like, be
Oh
very,
gosh.
like, your body just went through an absolutely just all encompassing event, like mentally, spiritually, physically, emotionally,
Yeah.
everything, hormonally, like,
Yes.
you went from, I mean, if you think about it, in the span of, 48 to 72 hours, if you look at the entire time of labor, not just active labor, but the entire process, like, you went from creating a human being to pushing that human being out of your body to feeding that human being
Oh gosh.
in like a 48 to 72 hour time period. Hello, the hormones going through you during that transition are wild. Okay. And it's like, it's okay if your body's like, okay, I know that I was made to do that, but that was an event, and I'm gonna need a little time to rest. And I love that emphasis just on breathing. And one of the things that's helped me kind of in this later part of pregnancy, thinking about like exercise and all that type of stuff, because I know that there is this emphasis on looking good or feeling your best or all that type of stuff. And like, frankly, I don't like those messages,
Me neither.
because it makes the motivation wrong.
Yes.
I just recently started walking every single morning. And the reason why I started walking every single morning was not because I'm like, oh, like I'm starting to get fat or whatever. Like I have gestational diabetes. I was managing it fine with diet alone. I don't want to go for a walk every morning if I'm managing this fine with diet alone.
Right.
But I started walking because I started learning, like, actually, walking helps to regulate your nervous system.
Hmm.
And I was starting to feel really anxious about different things. And, getting close to birth, my kids are going to school in a few days, like, hello,
Yeah.
and I was like, let me go walk every day. And I did it for the purposes of helping to regulate my nervous system and actually decrease anxiety. And it worked. And it's like, I feel better. And so because I'm feeling better, I'm I'm making those other better choices, diet wise and
Yes.
lifestyle wise and
Yes.
all of those other things, and it all just kind of feeds in together. So I think making sure that your motivation is good. So like, yeah, it's like, okay, so you literally, the only exercise that I need to do is breathing. Yes, the diaphragm is a muscle. And yes, it has been cramped your entire pregnancy. Like, it's hard to breathe towards the end. And you
Yeah.
need to give that muscle, be like, hey, look, you got room again, man. Like, let's go. Let's do
Go
this.
for the full range of motion. Yeah. I'm actually really glad that you said that, about like regulating your nervous system. And I think that you're absolutely right. There is this entire culture that, if you're not like on the floor, like collapsed after a workout, like it's not a
Right.
good workout. Like it's not true.
No.
Um, and so first of all, like I would love to disband that. Like,
Well, it's
yeah,
not
that's
something you're going to keep up with.
no. And
It's
also
not
like,
something
you
you're
don't
going to
want
keep
to
up
feel
with.
more tired after
Right.
doing a
I
workout.
feel I take a brisk 20-minute walk in the morning and I come back and I feel energized.
Yeah,
And
absolutely.
that's, but it's like, I've done the exercise, like my body got what it needed, my nervous system got what it needed.
Yes.
I'm ready for the day.
And that's the thing too, like your body, like we've just been saying, like your body just went through a major life event and like maybe it didn't go as well as you wanted it to, right? Like,
Yeah, there's that.
yeah, and like that's something that we should definitely talk about. But um, like your body needs to like calm down, like the hormones need to settle. Like you're also not getting sleep, you know.
Yeah, that's
Let's
a huge factor.
but then
Huge.
like I think that as like culturally, like a lot of us just don't know how to rest. And we think
Mhm.
that we know how to rest, but like resting isn't like it's okay just to be and
Yeah.
just to like sit and like not be productive. And that's actually one of my favorite like like parts of like the postpartum like time, because like so many people who are on maternity, we can talk like maternity leave is another subject, but like
That
who
is
are
a
on
whole episode
leave.
unto itself.
It is, it totally is. But like people who are on leave and they have no obligations but to be there for their child, or like be
Mhm.
there like and just like recover and relax. And like some people have a really hard time with it because like they just like
Yeah.
they're like running up the wall. They're like, I just sit here, like what do I do? Just like watch Netflix? Like
Yeah. It is hard. Like that's something I've tried to be more intentional about during this pregnancy. And it's hard, especially when we have our phones and we can be accessible to everyone at all times. But
yes.
we also have access to any information that we want at all times, right? And so it creates like we live in this world where we just kind of create our own anxiety to a certain degree. And I say this as somebody who is absolutely in that camp. Um, but yeah, it is hard to take that rest, but I, just focusing on breath and then slowly but surely. And yes, ladies, at 6 weeks, your doctor tells you that, you are cleared to do everything, and that includes sex. And I just have to throw this in here. Just because you're medically cleared doesn't mean that you're ready. And if you're not ready, you don't have to do it. It's fine.
Oh yeah. I mean, I can tell you how many times like I've seen people postpartum and I'm like, okay, so have you returned to sex? And they're like, no. And there's almost like this guilty feeling that they haven't. And
Yeah.
I'm like, no, like you if you're not ready, you're not ready. Because like first of all, like maybe your birth was traumatic. Like why don't we like allow your like why don't you like give yourself a little bit of space to process that? But like also like you're going to feel weird. Like you feel different postpartum because it's
Yeah.
not your pregnant body. It's also not your pre-pregnant body. It's a totally different body. And so
Yeah.
you're trying to navigate the space where you're like, well, like, what am I? Like, I feel like a little like wiggly for crying out loud. Like,
Yeah, and and having to adjust to that reality, but also, your former erogenous zones are now like public
yep,
utilities. Like you're
yeah,
breastfeeding, like
yep,
the purpose of your body is very different. And that's also a weird thing to reconcile. And also, just the emotions that you feel towards the emotions you feel towards your baby, that your mind is all about like keep this child alive. I have
yeah,
a husband, really? I don't remember. Like I don't
yeah,
care. Like it's all about keeping this baby alive. And it's okay. Like, just what I would say is, just and we're kind of getting a little bit on a tangent here, but it's all incorporated, body, mind, it's all connected. If you are feeling tense, and I
mhm.
know you see a lot of this, it gets transferred to your pelvic floor.
Oh,
That tension can go there, especially if you're talking about having sex before you're ready,
yeah,
um, or before you're healed, or any of that type of stuff. So really being gentle through that healing process it's so important in the short term, but also in the long term. It actually will increase it will add to your relational and sexual health
mhm,
if you kind of take that time and process it with your spouse, with your partner, be like, hey, I wish I was ready to
yep,
like rip your clothes off and go, but I'm just not. And sometimes just talking that through can be really
absolutely.
helpful. So let's pivot a little bit and let's talk about C-sections, because one of the most fascinating things that I learned was C-section scar massage. And I think probably one of the biggest questions that women are going to have is, when should I start? And it's like, okay, obviously let the thing heal. Um, but what can you tell us about that?
Okay. So C-sections, yeah, C-sections are tough, because a lot of times women go into them not wanting a C-section.
Mhm.
Um, and for that reason, like, and the fact that you can kind of keep yourself distracted by, your baby, or just kind of like other things. Like a lot of women don't look at their scar. A lot of people just try to like ignore it and kind of like throw that under the shelf.
Yep.
Um,
Can
and
confirm.
I get it. Like I get it, right? Because like, it's like a sense of like body autonomy that like feels like it's stripped from you in a lot of ways. And some people, you know, feel fine with it, and like that's good, or you think you feel fine with it. Yeah. Um, but the big thing, so when you cut into the abdomen or when you cut into any part of the body, you're going to cut through, yes, layers of tissue, but also nerves that innervate, at least from a sensory level, from those areas. So you're going to have like a lot of numbness. And then with the way that our bodies heal, it's like a multi-step process, but one of the last um, steps is scar tissue formation. And so our body lays down layers of collagen. And so like think about like your fascia that's in between like your muscles, or like in your organs. Like if you think about like what's in like a chicken cutlet, like when you kind of like
It's
slice
the
that open.
connective tissue in
Yes,
between your, yeah.
exactly. And so it has to reform that. And so it gets put down in a very disorganized manner. And so think about like if you were to brush your hair and all of a sudden like you have like this big knot, it turns into something like that. So I think I'm getting ahead of myself, but so first, like it has to heal. It takes, this is one of the areas like where it's
It's a
actually like a little bit
complicated answer.
nuanced, because like different tissues heal at different rates.
Yeah.
But people generally say like it takes like 6 to 8 weeks for tissues to heal, which is like also not true. Some things take longer, but anyway, I'm beside myself. Anyways, so during the time, like during the early time, like stages, like in the first few weeks after, like start by looking at it, right? Especially if you have like a very like traumatic experience, like you want to like you want to actually like face it. And the more you can face your scar, the more you can like process the story and process that part of the story.
I'd push back on that just a touch,
Yeah.
because if you did have a traumatic C-section, that can be very difficult. So what I would do is, if you're going to do that, make sure that you have somebody who can be an attuned
Yes.
listener when
Yes.
you do that, because it is going to be potentially overwhelming. I
Correct.
actually did that I started doing a little bit of C-section scar massage, trying to do that at the beginning of my pregnancy.
Yeah.
And it's not that I hadn't touched the area before, but like intentionally to massage the area. Yeah, I did. I think I maybe got 2 massage strokes in, and I just started bawling. Like I couldn't do it.
Yeah. And
I
that
could
can
not do
happen.
it. Yeah.
Yep. And that's why I say like start by looking at it. Like you
Mhm.
want to, and so like, yes, like you need to be in a place where like you can process all of it and whatnot. And so like I 100% agree, having people to talk about it with, people who will listen, people who you feel comfortable with.
Yeah.
That's really big. But then like, so like, let's say that you're at the stage where you're ready to do something. Um, I would touch like, not like, so if the scar is here, you want to go like around the scar. You don't want to, especially while it's healing. And
She's
this is
giving it, for those who are listening, she's giving it
yes,
probably like a 4-inch width around the scar.
yeah,
Yeah.
yeah. And the reason for that is that, especially if things are traumatic, they can become painful. And so you want to, what we would call, desensitize the scar. And so you would want to use maybe different fabrics, maybe different types of things. You know, I've certainly, you can use like a Q-tip, a cotton ball, a towel, a bed sheet. You can kind of find different things. And you want to touch that area, and it can just be light. It doesn't need to be anything. Um, because there is that association with things that tend to be more like traumatic and pain and sensitivity. And so, and certainly like I find that true with like the pelvic floor too all the time, kind of like how you said, like people hold tension in certain places, but there's also like an increased sensitivity sometimes. And so getting there. And so once things start to heal is when you can and once you feel comfortable, right? Like there's no rush on doing, can I just say that, like, there's no rush on doing a C-section, like mobilization,
Yeah.
like you do it at your own rate. Like it takes time for this stuff to, it takes time for the stuff to remodel, but having direct pressure to the scar itself and the tissue around it, that's going to help remodel it, and it's going to help realign the fibers in a better way. And so to help to prevent adhesions or like sticky little areas, but then also just to kind of like prevent some of that like puckering sometimes people have, that like kind of like shelf-like appearance. That's usually from scar tissue. And so that will break up and it takes time. So
Yeah.
like there's no rush. Like you have to be gentle with yourself. You have to, you know, like just there's a lot of acceptance and a lot of like, you know, letting go of control, I think, postpartum, that I think is really hard for a lot of people. And I think C-sections, for so many reasons, can come into that. That's especially true.
Yeah. And there's definitely a range, and I just want to call this out. There's definitely a range of experience with C-sections, right?
Yeah.
And just as there is a range of experience with vaginal birth, vaginal births can be traumatic, C-sections can be traumatic, vaginal births can be wonderful and glowing and heavenly, and so can C-sections.
Correct.
You know, I have friends who've had C-sections and they're like, they were great, loved them, got in, got out, was done, you know, it was awesome. So just wanted to take a minute to acknowledge that there is that range. But what we're talking about in terms of the physical healing process applies across the board.
Correct.
That scar tissue massage is going to be important, whether you had a traumatic C-section or not. It's just the way that you approach it is going to be a little different.
Correct.
You know, somebody who had a great experience with a C-section can probably just get like right in there, like go to town, like, yeah, let's do this. Let's get that tissue. And somebody who had a harder time, it might take longer. But I really appreciate that you're bringing up that point that it's never too late to start and to go at the pace that feels right for you.
Yes. And one more thing that I should actually add. So a lot of the times, people will be cautioned against doing any kind of mobilization early on, any kind of direct mobilization. But what you can do, guess what? Like breathing, that's an indirect mobilization. So you're expanding your belly and letting it contract. And that's actually probably one of like the best ways that you can start, just by, because it was going to get everything to stretch out. So if you really get like a good deep belly breath in and then let it contract and relax, and, you know, and when I say contract and relax, I mean, like you just let it like elastically recoil, like back to its normal position. That's going to get movement, and that's going to help the fibers like kind of redirect themselves.
There you have it, ladies. That's the only exercise you need postpartum. Just kidding. just breathe. Just breathe.
Yeah.
Okay, so final PT question.
Mm-hmm.
What is one of the main issues that you find you can help alleviate for women during pregnancy and during the postpartum period? Like in your practice specifically, what's one of the
main things? Low back pain.
Yeah. I can confirm. Oh my gosh. I started out with bad low back pain. I've been seeing a chiropractor the entire pregnancy.
That's great.
Yeah, that's been a godsend, because at one point I ended up getting an inflamed disc that gave me a pinched nerve. And after I had that pain, I was like, you know what? I feel like labor's going to be fine, because nerve pain and muscle pain are very different. And nerve pain, I went into my chiropractor and she goes, kind of makes, you know, that whole phrase of getting on your nerves to another level. And I was like, yep, it does. It absolutely does. Yeah. Low back pain. Yeah. Like, if you have low back pain early in pregnancy, hammer your doctor for a chiropractor and a pelvic floor PT referral, because it does not get better.
And it does not need to be there that way. Like that's not another, like, this is another example of like, this is not a normal part of pregnancy, right?
Yes.
Like it's actually not normal to get any kind of pain, right? Like it's common because there are a lot of changes that happen in your body, but like, it's actually not normal for this to happen.
I get periodic low back pain, but I know how to resolve it.
Yes.
And that's the key. That's the key.
I could not be happier that you said that, because that's actually one of the things that's like my favorite thing to do, like teach people like how to troubleshoot problems, like when they arise, because guess what? Like they're going to, right? Like, like I would love to say that everybody has this perfect, flawless pregnancy, even if they go to PT or chiropractic. But like the fact is, it's like our lives are weird, right? Like if you already have kids and you're pregnant, like you're going to be like on the ground, you're going to be bending over a lot. You're going to be, you know, moving. And like, those are just like all situations where, you know, you can
Or
And
apparently driving is like terrible because like the car seats are the worst. And it's like, well, you know what? I have to drive like 30 minutes to go to my OBGYN appointments. So this is just how it goes. Yeah. And so how do you manage just basic daily living stuff?
yes.
Yeah.
Yeah. And that's something that like I think PTs do a great job with. Just kind of like helping you functionally. And especially like if you are postpartum and you're taking your kid into like putting a kid in and out of a crib, like cribs are terrible in my opinion. Because like you have to like reach over, like you're creating a really long lever for your like body to have to like
Yeah.
move this child who like ends up weighing a lot, even if it's like,
That's why you have spouses and partners.
yeah.
That's you go get them. Yeah. Okay. So last question of the interview. Obviously we are a fertility awareness organization and we are spending, we're doing a series on pelvic floor physical therapy. And, this might seem like a weird connection, but one of the things that my partner, Mary, and I have found is that, once you start going down the rabbit trail of fertility awareness, you start getting into all of these different things because you start to see yourself as a whole person. You start to understand the way that stress impacts your hormones and then how you read that in your chart and so on and so forth. And it's just like one thing leads to another. So that's why we are covering this topic, because this is one of the rabbit trails that we've gone down and we love it. So Emily, one of the questions that we ask all of our guests, and you said you didn't like doing elevator pitches at the beginning. You're really going to hate this one. If you had to give your elevator pitch for why a woman should use fertility awareness, what would you say? Go.
I would say that fertility awareness gives you a complete understanding of what's happening in your body. It gives you, it takes out a lot of the guesswork of things that you're feeling. And it gives you a lot more autonomy so that you can, intellectually speak to somebody and say, this is what I think is going on and this is why. And I think that having that advocacy is super important, because I think a lot of the times people end up in a situation where they are trusting the expert in front of them, and maybe second guessing what they're feeling in their bodies, but you know your body better than anyone else. And I think that fertility awareness just really drives that home and gives people the language to speak about it.
Yeah. And it's an overwhelming language to learn, which is why we're here. So Emily, thank you so much for joining me today. This was awesome. I know that this is going to be a great episode people are going to love. Everyone, we are, this is part of a pelvic floor series. My partner, Mary, is doing an episode on painful sex. And then we will have a general Q&A episode. I don't know when these are getting recorded. We're trying to tee this up all before I go into labor. We're in the crunch time. But thank you guys so much for listening today. And if you would, whatever platform you're listening to our podcast on, if you could give us a review, we would love that. That helps to put our content up in front of other people. If you'd liked more resources on pelvic floor physical therapy, we will put a link to our website in the show notes. We have an amazing external resources page for all sorts of things, and I'm pretty sure you can find Emily on there. She is Fiat Physical Therapy in Alexandria, Virginia. If you're in the area, check her out. And I think that's it. All right. Thank you, guys.
Thanks, Emily.
Yeah.